Hello, I'm Dr. Kirk Ohanian, a radiologist at St. Joseph Hospital. I'm going to speak to you about Image Wisely, a campaign started by the American College of Radiology and other medical societies to raise awareness about radiation safety and imaging. As a patient, it is extremely likely that you will require some form of imaging during your diagnosis and treatment. This may be as simple as a chest X-ray or as sophisticated as a PET scan. Today we are going to focus on X-rays and CAT scans, not only because of their widespread use, but because they use X-ray beams, a form of ionizing radiation. Why is that important? Well, ionizing radiation can harm living tissue, particularly at high doses or upon repeated exposures. The cumulative effect of this damage increases the risk of cancer during one's lifetime. To better understand the risk, it's helpful to put it in perspective. We typically measure radiation dose in units called millisieverts. Each year we are exposed to approximately 3 millisieverts of background radiation. This is naturally occurring radiation that comes from the ground, from outer space in the form of cosmic rays, etc. In comparison, a chest X-ray has a dose of 0.1 millisieverts, which is about 1/30th of the naturally occurring radiation. On the other hand, a CAT scan of the abdomen and pelvis has a dose of about 10 millisieverts, which is about 100 chest X-rays or 3 years of background exposure. Even at this higher dose, the risk of additional cancer during one's lifetime remains low, estimated at about 1 in 1,000 to 1 in 10,000. But what happens when you have multiple exams? Well, you can think about your radiation exposure like sunlight exposure. On a clear summer day, even a brief exposure can lead to significant sunburn. On a cloudy winter day, on the other hand, you can be out for hours without significant risk. So when thinking about the risk from multiple exams, it is important to think about all of the components of your exposure. Not only the number of exams, but the intensity and frequency of exposure during those exams. So a few exams with high dose may carry the same risk as several with low dose. Imaging technology is also attempting to address these issues, with many recent advances aimed at reducing radiation dose. For example, dose modulation, an exciting technology that reduces radiation dose actively during a scan, is already available at St. Joseph. A recently enacted law in California has also put the spotlight on radiation safety, requiring that radiation dose is included in the reports for CAT scans. While we have focused on the risks of imaging, it is important not to forget the benefits. Since these vary from case to case, one of the best ways to understand the benefits is to ask your physician. This can be as simple as asking, "What will we learn from this exam?" Or, "Will decisions about my health care be determined from my imaging?" Or, "Are there any other imaging options available?" It is appropriate to have concerns about imaging, but these should be balanced against the value of imaging for you and your physician. When you know the risks as well as the benefits, your healthcare decisions will be much better informed and much more confident. For more information on this topic, please visit the Image Wisely website at www.imagewisely.org. On this website you will find links to videos, radiation dose charts comparing various imaging procedures, and much more information on radiation safety and imaging. Well, that is all for now. Thank you for your time.